There's a crucial molecule in your body that helps control everything: your circulation, your energy, your stamina, your heart, even your sharpness of mind. It's called nitric oxide. But after age 40, your body makes less and less of it. Less blood flow, less stamina, less of you. But now there's N101, the nitric oxide lozenge developed by Dr. Nathan Bryan, the world's leading nitric oxide researcher backed by Nobel Prize-winning science. N101 is designed to naturally restore your body's nitric oxide levels. Just do what I do and let one dissolve in your mouth twice a day. I especially make sure to take it before workouts. N101 goes to work in minutes, releasing nitric oxide directly into your bloodstream, supporting healthy circulation, boosting oxygen delivery to your muscles and brain, helping you feel the way you're supposed to feel. More energy, better blood flow, sharper focus. Day after day. N101, it's the science of you working better. Visit HoffmanNO.com. That's HoffmanNO.com and use coupon code Hoffman10 for 10% off N101. Welcome back to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. We're talking about hyperbaric oxygen therapy, which is more than just treating divers for the bends. That's how that originated. And that's why some of the chambers have been established. Usually if you go to a place like, Cayman Islands, Turks and Caicos, Curacao, they're going to have a hyperbaric oxygen chamber because divers sometimes have mishaps. They get the bends, but there's more to it than just treating divers' accidents. With us is Nicole Garrett. She's founder and COO of Under Pressure Hyperbarics. You can find them at Under Pressure Hyperbarics?
Underpressure.com.
Underpressure.com. All right, good stuff. All right, so one of the limitations, and I think there was at one point a hyperbaric oxygen therapy center here in New York, but there are actually some limitations when it comes to setting these things up because these chambers are big, they're heavy, they involve oxygen, which sometimes runs contrary to fire safety ordinances. And so it's tough to do business in certain places. I mean, we get requests. This is a podcast that's national, international, but we have a lot of listeners in New York. So you plan to come to New York, or you plan to buck the bureaucracy in terms of setting up a facility here?
I mean, we got one in Beverly Hills who has probably some of the tightest oxygen restrictions in the country because they have so many surgery centers. So I think we could do it.
Okay.
And actually would love to, but you're right. I mean, the chambers, if they're well built, are heavy because they have to withhold a lot of pressure. There's a lot of support equipment, and then there's a lot of restriction to storing a lot of oxygen on site with most places, which can be the limiting factor. So you're looking in New York at craning and removing window panels, reinforcing floors, and then pulling extra permits for, oxygen storage and distribution.
You have to find an accommodating landlord to underwrite that, assume the liability, and so on. So, yeah. And then the other question arises, is it dangerous? I mean, can these things explode? Obviously there's a safety concern because it's oxygen concentrated and, you got to be very careful about fire danger.
Yeah, and they can, the US had a very clean track record until the last few years when everyone started getting a hyperbaric chamber. And I was just reviewing before we jumped on the MOD report on the most recent chamber fire out of Arizona. And you took items inside, specifically cell phones, tablets, battery-powered devices that, don't handle pressure well. Right. And no surprise to anyone who's been doing this for a while, there was a fire and he did not make it out.
Okay. So, yeah, obviously with the correct precautions, it's safe. But so what's it like for a person undertaking this? Is it claustrophobic? How long do you have to do it? Is it uncomfortable? Do your ears pop? What's the deal?
Yeah. Number one fear expressed before people start is, I think I'm going to be claustrophobic. Can I get out? Do you have emergency protocols? And then pretty much everyone comes out going, oh, that wasn't so bad. Kind of liked it. What it feels like itself, we put you in the chamber. I kind of describe it as flying without turbulence. You're going to feel the pressure change on the ears the first 10, 15 minutes. You have to clear your ears, similar to landing in the airplane.
Mm-hmm.
And we coach everyone through on how to do that. And if we need to, sometimes we need to clean out the ears a little if there's a lot of wax, but we can get you there. And then you just hang out and breathe oxygen during the treatment. Treatments are 1 to 2 hours. Usually you do 10, 20, 40, even 60 treatments. I think that's the biggest thing most people underestimate is the frequency and duration you need to do these to get a
So
full
it's not
treatment
like a
course.
one-off, it's a series of treatments.
It's a series of treatments. So you want to go in knowing, like, I tell people this is your new part-time job. You're going to be here every day for the next 2 or 3
Mm-hmm.
months. Schedule it in your day. The treatment itself is very relaxing, very therapeutic. People really enjoy it, and you feel good during the process. You sleep better, your cognition's great. So that's not the hurdle. But yeah, just planning on how long you're going to need to be here and being consistent. You want to treat it like your antibiotics. You don't want to come 1 or 2 times and then wait 2 or 3 months and come again and expect that, you fixed the problem.
Okay. And so what do people do while they're inside there to avoid boredom? Are there any possible, I mean, you could take, I guess, a paper, people still have paper books. I mean, you could actually read a
Yeah,
book or a
so
magazine.
we have a TV on the outside of ours, and we have
Okay.
speakers on the inside.
Mm-hmm.
And we can talk to you through the speaker as well. We have a little sound powered phone that we can talk to you through. So it keeps the electricity out or at the required levels, but gives you something to do. Our chambers are full acrylic all the way around, so you can see through. There are in like UCLA, the big university multi-place type chambers, you can take a book or something in.
Mm-hmm.
But that's generally what it is watch TV through a protected device or read a book or, you could take something to write notes on and stuff like that.
Watch some old episodes of Friends or Seinfeld to pass the time.
Yeah,
Yeah.
we give kids crayons and stuff to color with so they can stay entertained.
Okay. Uh, so what are some of the other conditions that, we haven't yet discussed that people are using hyperbaric oxygen therapy for?
Yeah, outside of standard wound healing, we use it a lot post radiation from cancer treatments. That
Mm-hmm.
is something that is covered. Radiation's intention is to kill any blood supply and nutrient supply to the cancer, but then the surrounding tissue also gets damaged. Hyperbarics goes in and reverses all of that damage.
I would imagine there's a synergistic effect because the radiation is kind of a pro-oxidant treatment, and providing extra oxygen would be a really logical way to boost the efficacy of radiation treatment.
No, yeah, that's very intuitive of you, and you are correct. When they actually approved radiation or hyperbarics for radiation therapy, they approved it doing the hyperbaric treatment and then getting radiation within 15 minutes
Wow.
and targeting it that way. And then we're preventing those side effects from, the fibrotic tissue and the contracting skin and the things that can happen from that, or the cystitis if it's internal. But then they kind of went to, well, not everybody gets those side effects. Instead of doing it before, we'll just do it after if they have long-term
Okay.
side effects.
Right.
So yeah, not as
So
effective, but
also, so I guess also surgical recuperation, right? It might hasten recovery from surgery, or even as
yeah.
a prehab before surgery to uh, kind of condition the system to be primed better for healing.
Yeah, in fact, that's how I connected with who Dr. Lisa Castle is, who I partner with for our second center here, is they were sending us they specialize in post mastectomy
Yeah.
reconstructions, actually mastectomy and the
Which can be
recon.
dicey. Often there's poor healing, there's infections, there's a
Yeah,
lot of
and they
problems.
do a lot of nipple sparing, which, they're just taking everything out, all the blood supply, and just setting it on an implant and kind of hoping everything
Yeah.
works. So they would send us their diciest patients or the
Hmm.
ones they were most concerned about. And they retrospectively did a study and they were floored by it. They just ran some numbers through the system, but they had a 0.00078% failure rate on anyone
Hmm.
they sent to us
Wow. Fantastic.
versus their standard population. And they were like, if anything, we sent you the worst of the worst, the
Yeah.
chronic smokers, the, multiple stage surgeries already established. So that's what drove them to put this in. And now they are starting to do pre-treatments before the surgery to potentiate the tissue to see if they can even get a further reduction in complications.
Are there any contraindications to this, like certain conditions that people have where you say, you're really not suitable? I imagine pregnancy would be one of them, right? You don't want pregnant people getting that. But I
Right.
mean, it might be okay, but you don't want to fool around with that.
Yeah, pregnancy is one, and it's more of a because we don't know. The only times we treat pregnant women in a hyperbaric chamber is if they have carbon monoxide poisoning.
Oh, yeah.
And the fetuses actually have a higher uptake for the carbon monoxide than the mother. But there are other countries that do it without restriction. So, but you're right. Having a pneumothorax or
Okay.
untreated type collapsed lung, I mean, you are breathing compressed gases. When we do your clearance, we're also really concerned about your ears. We've had a few people that don't have eustachian tubes or don't
Uh-huh.
have fully formed middle
They
ears.
can't clear their ears, yeah.
Yeah, if you can't clear your ear, any gas-filled space in your body has the potential to be affected by this. So we don't want to rupture your eardrum. So we always send them out to the ENT to make sure they are or aren't safe. And a couple we have decided not to treat.
Are there any eye conditions where it is contraindicated, where intraocular pressure is a factor? I don't know.
So intraocular pressure is not affected.
Hmm.
Where they actually show it helps improve glaucoma. We've got someone who brings in their scans regularly, younger guy in his 40s who got early onset wide angle glaucoma
Hmm.
and lost about a quarter of his vision in one eye, eighth in the other before they realized he had glaucoma. And he comes in all the time saying, I'm getting vision back in the area that I was lost, even though the doctors told me it was impossible. So that's, kind of emerging research. But if you have cataracts, it can accelerate the growth of that. So you may
Hmm.
need cataract surgery a little sooner. And if you had a detached retina and they just did a bubble procedure where they
Yeah.
reattach it, you absolutely cannot get in the chamber because we will redetach your retina. We will compress that bubble and
Yeah.
there's nothing holding the retina in place.
Yeah. Okay. So yeah, so obviously you screen people carefully, but there are very
Yeah.
uh, unusual circumstances where it might not be desirable. For the vast majority of people, it's okay. Okay, folks, at this point, let's pause and allow one of our sponsors an opportunity to share an important message with you. So here goes. Listen up.
Has your digestive health been striking out due to poor food choices, medications, stress, and other lifestyle issues? This season, hit a home run for your digestive health with Dr. Ohhira's Probiotics. Dr. Ohhira's Probiotics is a live probiotic encapsulated in small, easy-to-swallow capsules that delivers Dr. Ohhira's signature blend of pre, pro, and postbiotics. Dr. Ohhira's award-winning formula contains a prebiotic blend of fruits and vegetables, which are naturally fermented with 13 strains of live probiotic bacteria for a minimum of 3 years. The result? Dr. Ohhira's game-changing postbiotic metabolites, which are key to supporting long-term digestive, immune, and cognitive function. Dr. Ohhira's Probiotics, an all-star formulation and the best probiotic on the market today for overall digestive health and wellness. Dr. Ohhira's Probiotics, available at Sprouts, Natural Grocers, and other natural health retailers nationwide.
Thanks for listening. Thanks for supporting our sponsors. They are what make intelligent medicine a continuing free resource to you. And now back to today's guest, Nicole Garrett. For listeners who are recovering from stroke, I think this is one of the most intriguing possibilities to hasten stroke recovery. I know if, God forbid, I had a stroke, I would absolutely undertake hyperbaric oxygen therapy. But how soon and conversely, how late can you undertake it? I mean, if you had a stroke like 3 months ago, is it going to make a difference if you undertake it now? And how soon after a stroke do you need to be stabilized before you can get the treatments?
As long as you're stable, you can get in right after. And when we pull people right out of
And
the
the sooner
OR,
the better.
sooner the better. Because, when you have a stroke, there's a part of your brain that's not getting oxygen.
Yeah,
So that we can get you in the chamber and through the compressed gases, flood that area with oxygen, even if the blood supply is interrupted. Now we're keeping that area alive.
right.
Same way we treat like massive blood loss anemia patients in the chamber. Um, so sooner the better. As far as how late, the big TBI research project I did with the Department
Traumatic
of
brain
Defense,
injury. Yeah,
traumatic brain injury,
yeah,
sorry.
yeah.
We didn't, the minimum time before they could get in had to be 6 months.
Hmm.
So they waited 6 months to see, I want to see if you plateaued with your normal healing before we'll even start to see if hyperbarics can help.
Hmm. Hmm.
And there was some limitations to the study with people being deployed, but They
We're
still
talking
had
military, IED
active
injuries and
military.
things
Yeah.
like that. Yeah.
Yeah, and they are finding blast injuries much more severe than a traditional
Right.
traumatic brain injury. But it still was very favorable. I do think sooner is better, but if the tissue is not dead, if it's
Hmm.
just got a low supply and it's
Right.
suffering, then hyperbarics has the potential to regrow those blood vessels and reestablish those connections.
Well, there's a theory in brain injury, you're well familiar with it, that if you have a stroke, there is sometimes dead tissue, just unrecoverable tissue, but surrounding it is an area called a penumbra, which is kind of an area of uh, low circulation. It's been stunned. It has the potential for recovery if blood supply is restored. And that's the basis for what's called revascularization treatment, which is standard treatment for strokes. They want to get the blood back as quickly as possible to recover any at-risk tissue in the penumbra, which has the potential to regenerate. And so that's the target, is to get that penumbra tissue to have proper circulation, oxygen supply, and survive.
Yeah, exactly.
Right. So okay. So I think there certainly is a rationale in stroke. Uh, so people who do this, are they self-referred or are they referred by doctors who are savvy about HBOT? And I imagine the awareness about this is minimal in the medical profession.
Yeah, we get a mixture of both. We get quite a few physician to physician referrals here. My medical director is a part of Cedars, which is a huge network.
Right. That's the big celebrity hospital, all the stars, hospital to the stars. And
Yeah,
I know it well because I'm from LA. On Wilshire Boulevard, it's like the place.
yes. So we get a lot of those. We do get a lot of self-referrals. I mean, we have on-site medical directions. So if you don't come in with a prescription, even if you do, we're still going to do our full clearance and write our own. Um, it's increasing on the self-referrals, but you're right, a lot of physicians are not fully aware of this. They only really get an hour of hyperbaric education in med school. So unless they had a rotation in residency where they actually got
Or they like
exposure to
dive
it,
medicine where they can specialize in that. Yeah.
yeah, or they specialize in wound care, which is pretty rare
Okay.
too, they usually just don't get the exposure to it. And so then it becomes like, well, does it even work? And are you sure? Some are for it, some are not. Usually they send us the worst patients that,
Yeah.
Hail Mary. And then when it does help those, they start going, okay, well, what else does this do?
So what about respiratory conditions?
Yeah, it used to be a huge concern if you had COPD. We
Hmm.
wouldn't put you in a chamber. You're going to
Wouldn't put
stop.
you, wouldn't put you
Would, yeah, would not
because it
because
might
they were,
hyperinflate the lungs. Is that the idea or something like
no, they
that?
were more concerned that you would stop breathing because
Oh, I see.
but you really have multiple mechanisms that tell you to breathe, not just too much oxygen, it's too
Hmm.
much carbon dioxide also. And so that still builds up even if you're in the hyperbaric chamber. Those patients actually really love coming
Uh-huh.
because they're so chronically short of oxygen that it's
Yeah.
the only times they feel like they can breathe. When they're doing a series with us, they tend to just have a bit better quality of life. I don't think they get, unfortunately, extended quality from just the COPD from hyperbarics, but while they're here, it's very beneficial.
It's a temporary fix, and it certainly can help with their quality of life while they're getting the treatments. Uh, so uh, I also, this is interesting. I just had a question on my radio show. Prior to doing this, I do my radio show. So earlier today, I had a question about autoimmune hearing loss, which is normally treated with prednisone. It's a condition where the immune system attacks the inner ear and damages the hearing apparatus. And I looked at all the plausible treatments besides prednisone, standard treatment, and immunosuppressive drugs. And what came up for me is hyperbaric oxygen therapy. Is that something you're familiar with?
Yeah, it is actually an FDA approved indication now. A lot
Hmm.
of insurances are paying for, we refer to it as ISSHL. Let's see if I can say it. Idiopathic sensorial neural sudden hearing loss, something like
Okay.
that.
That's
But
why you get
basically,
the big bucks because
yeah,
you're right.
yeah. But that's exactly the protocol is you start with steroids. If that doesn't work, then you immediately get in the hyperbaric chamber. And usually stats show steroids alone, you have a 50-50 chance of recovering hearing.
Hmm.
Hyperbarics alone is about a 50-50 chance. And when you put them together, it's about
Yeah.
a 70 5% chance.
Right. It's not an either or. It's the synergy of the two that may
It's a
actually help.
synergy. Yeah, and I think we're really working on the anti-inflammatory effects of hyperbarics with that.
Mhm.
It's a very potent anti-inflammatory.
I think the theme here is at-risk tissue. If you have at-risk tissue, as in poor wound healing or diabetes or a stroke or even a heart attack or an autoimmune condition, there is the potential that this might help.
Yeah, absolutely. We're seeing more and more with autoimmune too. Particularly we've had a slew of lupus patients, but
Hmm.
when they get in this like super inflammatory response and their body starts almost attacking itself, if we can calm down the inflammation, we can stop that response.
Hmm.
So it may not cure the disease, but we can stop that symptomatic response. And even with Crohn's disease, when you put someone in the hyperbaric chamber when they're having a flare up, we can stop it in a few days versus 6, 9, 12 months, and then they can change their diet and find their triggers. And that's huge because you have a small flare up with Crohn's and it's another 3, 6 months before you have, regular movements again. How do you know if that was the trigger or not?
Uh-huh. Do you combine this with any kind of nutritional protocol or any kind of supplements that might synergize with the HBOT?
It depends on what you're coming in for, but
Hmm.
yes, usually. Most of our patients we put on some of our standard kind of wound healing supplementation because
Hmm.
a lot of what we are working on is blood flow. So zinc and vitamin D and making sure just a lot of your core vitamins are in place. And then from there, we kind of see what else you may or may not need. Surgical support, we look at some other modalities as far as inflammatory bromide,
Bromelain.
bromelain, yeah,
Yeah.
sorry,
Yeah.
bromelain and trying to think of the stuff that helps for bruising. But yeah, so we do have protocols we
Bioflavonoids
recommend.
of different kinds. Yeah.
Yeah.
I would think there might be a synergy with nitric oxide support, dietary nitrates, with beet derived or other types of which are circulatory enhancers. They open up the circulation, and maybe there could be those could work together to promote blood flow to compromised tissue.
Yeah, I would think so. And it'd be fun to do a study on, pre and post oxygen tension tissues with and without nitric oxide enhancers.
Okay, so speaking of research, where's the research going on this? You must be either yourself participating in active research or you go to meetings of the Hyperbaric Oxygen Therapy Society and there are studies ongoing. Where's this headed?
A lot of it's on anti-aging. The kind of
Oh,
big landmark study that came out a few years ago was it actually lengthens our telomeres.
hmm.
So they were able to put about 20, 25 years of length back on telomere, on the tails of your DNA in this study. So we're about 5 years out from that study. So now we get to see, does putting the length back on the DNA tails actually lead to longer life or better quality, or is it just a fun stat? But no, we're seeing on a DNA level, it's kind of reversing the aging process.
Well, this is why you're located in Beverly Hills, because this could be considered a kind of a wonky optimizing, not necessarily for sick people, uh, striver kind of therapy.
Yeah, I mean, we do treat a lot of celebrities. We even treat a lot of celebrities who have hyperbaric chambers in their home,
Oh
but
my
they
goodness.
they have the more mild versions,
Yeah.
and they, sometimes they come here after a surgery or something, and the doctor's like, you got to go to this one because it's the real thing. But they come back because they're like, no, I noticed the difference.
Well, I imagine, yeah, there would be an adjunct to, cosmetic surgery to facilitate healing
Yeah,
because, that could actually help. So, you probably are on at least the cocktail circuit with some celebrity cosmetic surgeons, plastic surgeons in LA who say, hey, go to the under pressure hyperbaric therapy center for your aftercare.
yeah, no, yeah, we definitely are. And then a lot of them, like I said, will continue long after that because you really do just feel good when you're getting in the chamber a lot.
Indeed, for just feel good, anti aging, etc. Okay, well, great stuff. And I think this has a tremendous future. I think, one of the limitations is A, lack of recognition, B, the cost, because it's, insurance companies are sometimes reluctant to cover even reasonable treatments. They draw the line at, sometimes, they'd rather prescribe, a very expensive drug that costs, $100,000 a year than prescribe a, quote, natural treatment. Again, also not something that is supported by the pharmaceutical industry because you can't patent oxygen, right? And so there are some barriers to acceptance of this. But I hope that more and more people will become aware of this modality, and more doctors and health professionals will refer people for, I think a pretty reasonable prospect of cure or treatment. So good stuff. Anything else that we've left on the cutting room floor here that we want to talk about?
No, I think if you're looking for a hyperbaric center facility, really making sure that they have chambers capable of going to 2.0, so you're getting what we know currently based on studies is the true full therapy. Preferably they're buying their oxygen and not making it, because a lot of those concentrators don't maintain 100% very long because the components oxidize or the room that it's in can't make it, and make sure there's some medical direction on site.
Indeed. Yeah, and I think that that's actually one of the reasons I wanted to talk to you, because you're not just selling tents, that you can inflate and put a little pressure into, but you're doing it really the legitimate medically prescribed way, under a lot of safety protocols. And I think that that's the correct way to realize the full potential of this treatment and not just get a little hint of the benefits. So great stuff.
If you're going to invest the time and the money, I think you should do it right. I mean, I genuinely probably could have retired selling chambers to everyone who wanted one of the cheap ones with the incentives I'm offered, but I don't think it's the right efficacious thing to do. So we hold steady on the safe and true treatments and encourage people to do that research and get that themselves.
Well, great stuff. Thank you so much, Nicole Garrett. And the website is underpressure.com. Learn more about this type of treatment there, because I think it's going to make a difference in a variety of health conditions. Good stuff. Thanks for joining us, Nicole.
Thank you.
I'm Dr. Ronald Hoffman, and this is the Intelligent Medicine Podcast. I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything intelligent medicine has to offer, including frequently updated, unbiased health news and fully vetted product and supplement recommendations. You're listening to Intelligent Medicine, a resource to help you take control of your health. We offer a balanced, objective analysis of all your health, wellness, and aging options, both conventional and alternative. Now you can take your engagement to the next level by joining FullScript. FullScript is my online dispensing platform that only offers curated, professional-grade supplement brands that I know and trust. Never counterfeit or expired, always stored and shipped correctly. Just go to drhoffmanstore.com for more information and to start your free FullScript account. Buying through FullScript offers fast, free shipping, optional refill reminders, a mobile-friendly site. It's safe, secure, and HIPAA compliant, and offers world-class support. Just go to drhoffmanstore.com. You'll get access to the supplements and features you need to help you achieve your wellness goals, including my custom targeted protocols that combine the products I recommend to address specific needs, heart health, immune support, and much more. It's all at drhoffmanstore.com. drhoffmanstore.com.